So just to give you a reference point of what you're looking at, first of all, I know the print is very small. I promise we're going to enlarge all of this so you can read it. The idea is just for you to get a gist of how the program works, and then we'll get much more into the detail of it. So what you're looking at, this is the screen as it would look. This screen over here on the left, that is the screen as it would look as you hit start encounter. And what this is actually called pre-charting. So what we do is when we're integrated with your EMR, we're actually able to kind of scroll through your last few notes, maybe any of the notes of your partners, and we create a clinical summary for you. So it says, hey, these are the treatments. This is what was done. This is how many physical therapy visits. The patient had an MRI, patient had surgery. Whatever you want us to pull, we can pull. So it kind of tees it up for you automatically. We can pull any imaging studies, whatever you say is the most recent imaging study, any lab work, any medical clearances. Basically, when we do the onboarding, each of your providers will be able to tell us what they want pulled in this pre-charting, and we'll kind of have this summary waiting for you. The reason for that, as you know, is we all look at something before we walk in the room. Usually it's the last note. But I kind of thought it would be great if you could get all of the things here right away, the imaging, the last few notes, any surgeries, anything of that nature. So we created an automated process to do that. I just wanted to prove to you what this is. It's actually a recording of an actual visit that we created. So I'll turn the volume down so I'm not talking over the speech here. So if we just fast forward this a touch, the way this kind of works, the gist of this is live time in your visit. We are actually capturing the clinical office note. At the same time as this is building, we have several agentic agents that are building things simultaneously during the note. So we're starting to capture ICD-10 codes, then we're going to capture CPT codes, we're going to capture all the orders. Obviously, we're in the beginning of the note here capturing history, so we don't have any orders yet. But you can see with the line scrolling across the screen, all of these agents are listening, trying to figure things out. Now, the most important one is what we call checklist. This is 100% customizable, and what this is your ability to say, hey, what do you want to be reminded of? I'll give you probably our most powerful example. Damien, you say, I want to order an MRI of the patient's shoulder. Well, we look into the EMR, we see this is an Aetna patient. We actually pull the Aetna payer policy. We find out that these are the 5 bullets that you need to get prior authorization for an MRI. And we actually look in your note and say, look, you only have 3 out of those 5. You're missing 2 of them. So that's actually what this window is telling you, is you're missing some documentation and you're not going to be able to get prior authorization. But this can be custom built to whatever you would like to be reminded of. So it's a checklist for you. But again, the power of this is it's actually building it live time during your note. So you can capture all of it before the patient leaves if you do want to edit it and add more information. So if we now fast forward to the end of this visit, you'll see what we've actually captured is a very detailed clinical note, and we're going to go over that in much more detail so you can see it. You can see all of these green items under checklist. They actually are the ones that you've captured, all of the reminders that you wanted to capture that you did, and these in red are the 5 outstanding ones that you have to choose whether or not you want to change anything. We also have all of the orders, and we actually also end up with all of the codes. If I just scroll back here a little bit, we end up with all of the codes as well, and those are both ICD-10. I didn't let it go finish enough, but there's also the CPT codes. So all of this is captured live time so that when you finish the visit, all of this is done and ready for you. This is the actual application live time. So this is after that visit was recorded and done, this is what you look at. The reason why we created the demo video is because you have to click through each of these screens one at a time in the app, but we wanted to demonstrate for you that everything worked simultaneously. So the first thing I want to point out, I know you're a sports guy, this was somebody who had a softball injury, and it's the amount of data that we capture. So in the history here, we're able to capture all the VAS scores, a lot of details about the injury itself. The patient was taking ibuprofen. We captured the pertinent past medical history of diabetes. Specifically, we didn't capture occupation, but it says that the patient travels for business. And these are the details that scribes just don't pick up. So this was a softball injury. The patient was playing second base, which is different than outfield or pitcher, recreational level athlete, but was a former collegiate athlete. These are the kinds of details that human scribes never pick up. We then get down into the physical exam. Now, the only thing, if I don't know, do you use any ambient scribes now?
No, I have a human scribe.
So what happens with the human scribe? Do you dictate your physical exam to them, or you're mostly template driven?
No, I'm dictating it to them as I go. They have templates they're working off of so they can keep up with me.
Right. And so the beauty of this is exactly the same thing, is that you can put your template in here. And as you would imagine, the AI is definitely better at capturing everything that you're saying. It can capture absolutely everything, no matter how fast you say it. They never get tired. They never get distracted. So the ambient scribes typically do a better job. Not always, but typically.
Can they correct?
Yeah, so the ambient scribe is also checking for pair policy. It's correcting, it's making suggestions, it's coding, right? There's whole levels of things that obviously we do that a normal scribe isn't really capable of. I'm not knocking them. I used human scribes myself for most of my practice. They're wonderful. They became friends, but the reality is technology is kind of passing that job by. But obviously, that's for you to decide.
Can you change what you're saying during a visit? Like, my human scribe is great because I can say external rotation 30 degrees. Oh, strike that 40 degrees.
Correct. It'll absolutely pick that up.
Okay.
So this is not transcription. This is not Dragon. This is like, this is having an intelligent, that's the difference between agentic AI and robotics. The agentic AI is actually analyzing what you're saying. So it'll pick up all of that nuance. It'll filter out, like if you're telling a joke to the patient, it'll filter that out. If the patient's talking about Aunt Sadie's apple pie in Minnesota, they're not going to put that in, right? We wouldn't put that in. So it really is, it's something obviously you would have to see for yourself. But it's taken a lot of time to refine it to get it to this level. One of the advantages of Pinotage is all we do is orthopedics. So a lot of the other ambient scribe companies, they try to scribe for all subspecialties, and that's why they look awkward and they look, wrong, especially to an orthopedic surgeon. Our sole focus is this specialty. So that's why I'm hoping we do it a little better than most. You can see we capture all that physical exam, whatever you want to dictate, it's there. We ingest your templates, so it'll put it exactly in the templates as you want to. So even if you jump around from strength testing back to inspection, back to range of motion, we're able to pick all that up and put it where it's supposed to go.
Okay.
We capture the imaging review, all of the detailed, medical terms that you want to use. We have all those that we can capture. And then when we talk about the treatment plan, you can see we're able to capture a whole bunch of things. What was the counseling, activity restrictions, PT, home exercise program, drugs, injections, surgical discussion, and then there's the procedure note for the injection that was done. Now, all of this is actually captured live time. So when you walk out of the room, this is done, which is a big game changer. If we flip over to here, so for that MRI that you ordered, the payer policy basically says, hey, for United Healthcare, there has to be a pain score of at least 3 out of 10 and 6 weeks of conservative management, right? There has to be, which is defined as either PT, NSAIDs, or steroid injections. So if that's missing in the note, you have to decide, do I want to put that? You also have to say that this is a soft tissue evaluation. So we're looking for a rotator cuff tear, a labral tear, a biceps tear. A separate link is to say, hey, I'm ruling out malignancy. That for United Healthcare also gets you that MRI. Or you can say it's pre-surgical planning for a soft tissue surgery. But if you're missing any of these, all you need to do is click this button up at the top, which says start listening, and you just dictate what you want to put in here. So you say, oh, you know what? We're actually getting the MRI to rule out malignancy in the shoulder. Now it'll automatically put that in the note where it needs to go. That bullet turns from red to green, and you don't need these other bullets because you've satisfied the requirements for United Healthcare. Mm-hmm. If you click under here, again, these are all the things that you have now verified. So again, if for any reason you want to review them, you can. We're one of the strengths of the program is really this coding. Now, as a fellow orthopedic surgeon, how many diagnosis codes do you typically put on a visit?
2, maybe 3.
Right, because it's time, right? You're not going to go hunting for all these other codes that really, frankly, don't change your reimbursement. But what we're able to do is we can pick up the fact, if you look here at gastritis, that was the patient complaining that ibuprofen upset their stomach. We're also coding the adverse effect of the ibuprofen. We found that code for you. It's already there. We're actually coding the allergy to penicillin. And we're also coding all of those injury codes. This was a softball injury. Patient was struck or hit by a thrown softball, and that the baseball field was the place of the injury. Now you look at me and you say, Phil, why the hell do I want all that in my note? I don't need that. I'm getting paid anyway. Here's the nuance. If you now go to the insurance company and are negotiating rates, and you can demonstrate that you're doing much more complete diagnosis coding, it allows the insurance company to do much better tracking. And I promise you, they're going to give you increased rates because you're being a better partner to them. Now, instead of you having to sit and look up any of these codes, they're all there for you. So all you would literally have to do, because this will get pushed into your EMR, you just have to hit sign. They'll all be there. Now, if you don't like one of them, take it off, right? But we put them all there for you to make sure that you have a completely coded note.
No, we recently had a discussion in our group that we had a lot of doctors with coding like this. They had so many codes, and then unfortunately those codes followed the patient everywhere. They just kept carrying over to every note, and it was preventing us from getting paid because the orthopedic aspects were getting lost in the shuffle.
So are you a multi-specialty EMR or just your group?
It's just our group. It's a multi-specialty group.
Within orthopedics, but it's not gastroenterology, cardiology, pulmonology. It's not those things, correct?
Correct.
Right.
But people are putting on gastritis and things like that, and it's carrying over.
Well, so this is the power of the automation. So what's going to happen on the next visit automatically for you? These injury codes, they disappear because they only get coded on the first visit. Okay. So again, our logic is built in that is never going to get carried over to another visit.
Okay.
I do think you probably want the allergy status to stay. You don't want to miss that. That would be a bad one to miss.
Right.
Right. But the gastritis would disappear because we're not talking about it at the next visit. Okay. And so really what you would end up with, we do this automatically for you. So rather than you having to search or delete, the codes for that next visit are going to be limited to right shoulder pain, osteoarthritis, and probably the allergy to penicillin. And that's the only codes that are going to show up in a follow-up. We automatically weed them out because we will only code the diagnosis codes that you address in your note. So that's automatically done for you. You don't have to think about taking out the other codes or not clicking them. They will not carry over into the note.
Okay.
So again, making this automated makes things a lot easier.
Sure.
So now you have the actual CPT codes. This is where you get paid. So we picked up the X-ray with the correct modifier. What I really like about this is we give you your E&M code, but we also give you all of the logic. So if you click this button here, it actually tells you why you're a level 4 in column 1, why you're a level 4 in column 2, and why you're a level 4 in column 3. So if for some reason you disagree with this, you can override this whenever you want to. But I don't know if you're aware that Cigna has been downcoding everyone's office visits. Were you aware of that?
Yes, we're very much aware of that.
Right. So what happens is you got to write an appeal letter, right? When you have a level 4 visit, you have to write an appeal letter.
Right.
So if you look at this information right here, this is your appeal letter.
Yes.
Exactly. So we can automate this. So this gets put on whatever letterhead you want. It'll fill in those fields for you and automatically send it if you want. The only thing we won't do, I shouldn't say that. We're not going to hit the send button. We'll tee it up, but we kind of insist that a human at least says, okay, send it.
Right, and review it.
But all of this is teed up and automated so that anytime you say, well, I want to do an appeal, you don't have to have someone from the billing department read your note, pull out the logic, write a letter. That doesn't have to happen. It gets written automatically here. It's done, fully automated. Helps your RCM, the speed of your RCM immensely. And speed is everything. If you don't collect those dollars by 90 days, much, much harder to collect them.
Understand.
Then you get here, you can see the injection was billed. You're familiar with the concept of diagnostic pointers?
No, haven't heard that one.
So diagnostic pointers, whenever you bill a CPT code, you have to have an appropriate ICD-10 code that
Yes.
goes with it,
Yes.
right? So what we do is we're actually screening to make sure that you're not putting the wrong diagnosis code with an injection code. You're not putting the wrong diagnosis code next to your radiology code.
Right.
So we're actually pre-doing that work for you. So we're guaranteeing that it's the right diagnosis to go with that X-ray. And remember, in Doc Assist, what it'll pick up is, hey, you ordered an X-ray of the patient's shoulder and knee, but you didn't talk about anything in the knee. I don't have a diagnosis code for the knee. It's going to show up as a reminder to say, hey, I need some documentation if you want to get paid for that X-ray. So it automatically captures this. It's what we call optimized revenue capture. We're making sure you get paid and stay paid for everything that you bill, and that we're capturing all of your billings so you don't have to go back after the fact to do a reconciliation to make sure it got billed. And obviously, we pick up the drug codes as well, all of those with the correct diagnostic pointers. So as you would imagine, all of this is going to get loaded automatically into your billing software so that bill can go out electronically almost instantly after your note is done. So if you get to a level where you agree and you're happy with the quality of the note, it gets put in the queue for billing literally in 30 seconds after the note is done, with all of the coding done and everything else.
Okay.
Which helps revenue cycle. The last piece that we'll go over is going to be the orders. Now, each of your orders is captured discreetly. So these are your activity instructions. So if you say, well, Phil, I want this to go to my MA to print out and give to the patient. Well, as soon as you hit complete note, that will go through a task message in your EMR to your MA. We can automatically fill any template that you have, any letterhead you have, so we can map that out directly. Same thing with the physical therapy prescription. Where do you want that to go? Do you want it to just go directly to checkout? Maybe you want it to go to your physical therapy office directly. So as soon as you hit send, it goes right to the PT office, goes right to their scheduler, who is actually calling the patient while the patient's in checkout. Hey, let's get your PT visit scheduled for you. Same thing with imaging. The medications, again, it's all teed up for you, ready to go. All you have to do is review and hit, send. So we map all of this so that, again, by the end of the visit, all of this is entered for you. You have to review it. It's called human in the loop. AI regulation requires that, especially when we're prescribing medications, we can't send it directly. You have to review it. We can tee it up for you. It's called order staging, but we can't actually send it. You have to hit at least one button to say, I reviewed it and can send it. So that's the product in a nutshell.